Well, today's guest speaker is Dalia Blell. Dalia is a first-generation college graduate. She grew up in South Texas with a large extended family of mixed immigration status. She was raised to value family, education, and strong work ethic. Growing up, she spent summer breaks harvesting fruits and vegetables with her family in migrant farm worker camps in the Midwest. By the time she was 23, she had earned a bachelor's degree from Pan American University and a Master of Social Work degree from the University of Michigan. She is a licensed clinical social worker supervisor. She has practiced as a clinician for over 30 years in various settings, including community mental health, crisis shelters, school social work services, and higher education student support services. For the last 13 years, she has held the position of professional counselor and provided mental health services to students on the Dallas College Northlake campus. She also serves as the chair of the Dallas College Professional Counselors Council and has led several projects that support the mental health well-being of students, faculty, and staff. Some of these include mental health first aid, NOVA crisis response team training, online counseling services for students, and the TAO Connect. With that, I'd like to go ahead and turn it over to our presenter.
Thank you, Amanda, and welcome everyone. I used to be the chair of the Professional Counselors Council. I'm now the Assistant Director of Counseling for Northlake Campus, and I'm really excited that everyone is joining us today for our presentation, Taking Care of the Mental Health Well-Being of Students, Faculty, and Staff. And I'm going to let the rest of my team introduce themselves because they are just as skilled and valuable as I am to our students and our Dallas College community. Quinessa, you want to get started?
Sure. Good afternoon, everyone. My name is Quinessa Johnson. I'm a licensed professional counselor, and I'm a faculty counselor at the Cedar Valley campus.
Hi, I'm David Thompson. I'm also a licensed professional counselor, and I serve El Centro campus in our counseling services office.
Hi, everyone. Good afternoon. My name is Grenalda, and I am also a licensed professional counselor, and I am at Northlake.
You want to change the slide for me, David? Okay, so we're going to be speaking to you today about the challenges that we're experiencing during this time of uncertainty. We're going to reference the change cycle, and we're going to ask that you reflect on it as we go through this presentation. We're also going to share the survey results from recent national surveys on the impact of COVID-19 on college student mental health and communities of color. We'll present the American Council of Education's recommendations for supporting campus well-being and how Dallas College Counseling Services is collaborating with various teams to implement these strategies. And we're going to tell you about TAO. We're really excited about TAO as well as some of the other mental health well-being programming that we have going on for 2020, 2021. And hopefully we'll have the opportunity to have you experience a TAO mindfulness relaxation activity if WebEx cooperates, that is. Next slide. Well, since the pandemic, I've actually had the pleasure of doing this presentation several times. The first time was right when we went into shelter in place. I was asked by marketing and communications to present to them. And so I called the presentation at that time Chance of a Lifetime because it was really my way of reframing this experience that so many people were describing as very stressful, something we needed to survive and get through together. Not that that isn't true, but I really felt that things were so much out of my control that I needed to choose a name for my experience, so one that was going to work for me. And I felt that this belief about having a space where I was able to survive and thrive was so important that no matter what came next, I was going to have this space to grow. You know, just like in nature, when a seed takes root in really harsh conditions. I mean, I have seen trees growing from in between cement cracks. They figured it out. So I thought I need to have that kind of space as we were going through this pandemic. And although going remote was initially really challenging for me because I'm a technology refugee. I was not born on the technology ship. So I actually had to jump on board. It took a pandemic for me to like go full technology. And now, of course, I have a totally new vocabulary. Now I'm using words like I'm jumping on a call, see you on Teams, join me on WebEx. And not that it's not challenging, but it's something that I've learned to get, I've gotten used to, as well as collaboration. I mean, I always used to collaborate before, but when we went into shelter in place, it kind of became an essential need. And even though we continue to social distance, we've had to learn how to work virtually so that we can get back on campus safely. And now some of us are even meeting with students in person. I'm conducting counseling services in person wearing a mask. Something never in my mind did I imagine that I would be doing something like that, but I have been. And I wear hearing aids, so it's been challenging for me because people are wearing a mask, I'm wearing a mask. So I ended up having to buy a Bluetooth microphone that syncs with my hearing aids, and I had to learn that whole process of how to do that. And on top of that all, what has happened? Dallas College. We're now Dallas College. Our campuses are locations. They're not colleges anymore, and we're going through this major reorganization. And of course, not to mention the presidential election and all the national unrest and the disparity that is surfacing. Next slide, David. So this is the change curve. It's based on a model originally developed in the 60s by Elizabeth Kubler-Ross to explain the grieving process, to explain, what a person went through when they lose a loved one. Now this change cycle has been used to explain just any human response to change. So grief is a part of change, and it's no news that we're going through a very complex changes right now that we may feel like we're stuck or we're just bouncing around in this change cycle. So every time we go through a change, we experience a loss. So it's kind of like we're in shock and denial. We're going through anger and blame, just feeling so out of control that we want to kind of negotiate the situation that's not in our control. So human beings are biologically programmed to survive change. So when the systems with our mind, with our body and our mind and relationships become unstable, our brains produce really uncomfortable signals of a threat. Our body produces hormones that get our system into like fight, flight, freeze mode. And when we experience one crisis or one change, typically, we go through this process at our own pace, and we eventually get to acceptance. Like we accept the change, we explore what's next, we try to understand it, and we integrate what's happened into our daily lives so that we are then moving forward, learning to live with that change. And so we are sustain ourselves that way. However, currently we're going through so many changes, not just the pandemic, but we're going through the global crisis, this national crisis, the organizational change. So all of these things are impacting us at one time. And so our emotions, of course, are all over the place. Some days we might be feeling like in shock again because maybe we just learned that somebody got COVID and is seriously ill. The next day we may be grieving because we're thinking, well, I went on campus and it's no longer Northlake College. I see a sign that says it's Northlake campus. And so I'm grieving the loss of that identity. And then other days we may be celebrating the mere fact that we survived another day having gone to the grocery store wearing a mask, and maybe we noticed somebody that wasn't. And so we're not able to really go through this process of getting to be sustained over here because we're having so many things come at us at the same time. So as we go through this presentation, I want you to think about your place in this change cycle and how it's impacting you, how it's impacting your well-being, your quality of life, as well as your performance. Next slide, David. Of course, the one thing that hasn't changed is just the uncertainty of the situation that we're in. So social isolation may be part of our day. However, it may be the least of our worries if we're experiencing a lot of financial distress or if we're worried about losing our jobs. So this uncertainty may cause extremes in behavior, from insomnia to sleeping too much, eating too much, or just a loss of appetite, excessive use of substances, hostility, aggression, poor concentration, relational problems, and anxiety and depression. And of course, people with a history of trauma, they're being re-traumatized. The most vulnerable continue to be at high risk. And, because of stigma, just the lack of knowledge about the resources that we have, or maybe someone's in a really unsafe situation, they're not asking for help. And one of the major points that we want to get across through this presentation is that we're all experiencing some type of acute stress reaction. This is the first time that I can remember being in the same crisis as everyone else. Usually, students come to me for help, people come to me for help, they're experiencing a crisis, but I'm not experiencing the same crisis. But this time, we all are experiencing the same crisis, so we all know someone that needs support. Sometimes it's ourselves, and sometimes it's a colleague. So it's really important to think about the resources that we're going to tell you about, and to think of ways that you can instill self-care for yourself so that you're there for the people that you care about. Next slide. Oh, Quinessa's turn.
So even before this time of uncertainty, mental health issues has been a growing concern on most college campuses. We know that most mental health disorders emerge between the ages of late adolescence to by age 25. And so I'm just going to go over a few statistics as it relates to mental health in college students. 24% are diagnosed or treated with anxiety problems. 20% are diagnosed or treated with depression. We know that the earlier treatment is received, the better life outcomes for our students. Suicide is the second leading cause of death for ages 15 to 34, which falls within that category for our college students. And so the college years, it's a critical time to intervene, to save lives, and also to reduce the negative effects of mental illness. Next slide, please. And so continuing on with looking at some of the statistics, the Healthy Minds Network, in collaboration with the American Health Council Association, conducted a study that focused on student attitudes and concerns as it relates to COVID-19. 80% reported a negative impact or having a difficult time focusing. So my role at Cedar Valley is a little bit unique from some of my colleagues here that are presenting with me today. I'm a faculty counselor, so I do counseling, but I also teach courses as well. And so having struggles with focusing is probably one of the #1 concerns that a lot of my students have communicated to me. It's like, I'm here, I'm at home, and I get distracted easily. I used to study on campus, or my family doesn't really understand that just because I'm at home, I still have things to do, or they're just distracted by, other things that they could be doing at home. So that's a major concern with COVID-19. 60% have reported that it's more difficult to access mental health services. We had to go into this remote world for a bit, and so now we are offering face-to-face counseling services. A lot of our students are still anxious about coming on campus, so that might not be an option. And then there's some anxiety about, receiving services through this remote world as well. So that can be a challenge for accessing mental health services. 65% reported very or extremely concerned about how long the pandemic will last. So it's kind of like, when is this going to go away? Is this really our new normal? Is it going to be this way forever? 64% reported very or extremely concerned about people that they care about contracting COVID-19. 86% report concerns about their personal safety and security. 66% report that the pandemic has resulted in more financial stress. They may have been working in industries or jobs where they weren't able to transition to a remote environment at the beginning of the pandemic. So, they may have been furloughed, or they may have lost their job, or hours may have been cut, things of that nature. 69% report campus administration has been supportive during the pandemic, and 78% report that they perceive their professors as being supportive during the pandemic as well. Next slide, please. And so CHED.org has created this State of Student series, and again, just going to continue to highlight some of the data on how COVID is affecting students' academic performance. 56% said that they were moderately, very, or extremely worried about their mental health, and again, their lives have changed, significantly, as, they may be restricted as far as like their social support, being able to hang out with their friends, just everything has changed, and so it affects our mental health. 50% reported experiencing anxiety. 1/3 reported experiencing depression. Almost a quarter said that they knew someone with suicidal thoughts since the beginning of the pandemic. 40% of all college and high school students report feeling anxious about returning to school or campus. What is that going to look like, once we return? How are we going to maintain 6 feet of social distancing? How are we going to stay safe? Since the pandemic began, 55% report that they've offered support to a friend, where 49% have stated that a friend has reached out to them and provided support. 72% reported feeling hopeful or supported when a friend reaches out. 25% said that they did not reach out to counseling at their school because they felt uncomfortable doing so. And it could be because, again, there may be some anxiety about receiving services remotely. 76% of students who sought counseling from their school found it extremely, very, or moderately helpful. About only 1 in 4 students surveyed say that they feel that their college or school instructors take mental health seriously, and just 3 in 10 say that they feel comfortable telling their instructor if their mental health stops them from completing their work. They're afraid that stigma is going to be attached to them, so it's kind of like, I want to keep that to myself. I don't want that to be a part of my academic transcript or my record. Next slide, please. And so with COVID-19, it has revealed some deep-seated inequities in the healthcare for communities of color. Specifically, we're going to talk about Black and Latino communities. We know that these communities typically are of a lower socioeconomic status and have limited or no access to healthcare services. And so some research has revealed that Blacks make up 30% of the cases of COVID-19. Latinos make up 17% of those cases, and these populations are at an increased risk for serious illnesses because they're already possess these underlying conditions such as heart disease, diabetes, and things of that nature that they haven't been able to receive adequate care for because of lack of insurance. So there's uninsured and lack of a usual source of care. So typically there is no primary care physician. I don't have a doctor. It's kind of like, I take over-the-counter meds and things of that nature, and going to the doctor is like an end result, basically. These populations typically work in service industries, and at the beginning of the pandemic, they may have had jobs that were not able to be done remotely, so they weren't able to transition, to a remote way of doing their job, and so it's kind of like, do I go to work, take the risk of contracting COVID-19, take the risk of not feeding my family, not having a roof over my head, so they're at a higher risk. They utilize public transportation, which again puts them at an even higher risk for exposure. And they live in multi-generational families or low-income housing, which makes it very difficult to social distance or self-isolate. Everybody's going out and doing their thing. They're going to work, and things of that nature. And then they're coming back into this household. And so it's difficult, for them to be able to social distance. Next slide, please. So the American Council on Education identified some strategies that campus administrators could employ to support the well-being of students, faculty, staff, everybody on campus, during this pandemic. The number one thing is ensuring that communication to students is consistent, caring, and clear. Me as a faculty member, I really, I had to kind of bump up my communicating because I mostly teach face-to-face. I've taught online before, but I'm more of a face-to-face kind of person. So, I had to kind of think about what are some ways that I can continue to communicate, to make sure that they understand what's going on. Because a lot of students, that I would have in class, they would just kind of wait, wouldn't ask you questions, and I'd kind of read, things on their face, say, hey, do you get it? Help me to understand. Let me know if you get it. So, just making sure that you're communicating to your students because they may be nervous about asking, and things of that nature. So you want to provide that clear communication. One of the most important things that campus administrators can do to help to support the mental health well-being of students is making sure that we're supporting the mental health and well-being of our faculty and staff. Our faculty and staff, they've been on the front lines, since this whole pandemic started, serving students, finding, innovative ways, that we can provide services and things of that nature. So we want to make sure, that they are taken care of. So in turn, we can go back and take care of our students. What's also important, we are now Dallas College. So, we consist of these multiple campuses, but even with the different campuses, the needs of our students change consistently. And the needs of students on Cedar Valley may look totally different from the needs of students at Brookhaven College, basically. So it's important for us to make sure that we update strategic plans and that we're constantly assessing the mental health needs of our students so that we can provide those services to them. So this is going to be like a constant thing. It continues to change over time, and there's no one-size-fits-all model, so it's going to vary, from campus to campus, from student to student. So it's important for us to continue to update this strategic plan. And then we want to ensure that we're keeping equity at the forefront as well. And so David's going to, next slide, is going to talk to us a little bit about technology challenges.
Thanks, Quinessa. And maybe I should have put a trigger warning here as I name some of these new technologies that may have become a part of your life, definitely a part of my life. But before we get into those specific occupational changes that definitely here at Dallas College we've gone through, moving to the virtual environment, all of us may have been experiencing new virtual online technologies in a response to trying to limit our in-person contact with things. You may have ordered groceries online for the first time. You may be getting food delivered. Maybe you've done that in the past, a couple of times, you tried it out, but now it's become more of a regular thing that you're engaging in. Maybe you're using FaceTime in a way to connect with somebody who's maybe even just like down the street or across town instead of somebody who might be on the other side of the globe or the country. Maybe you've seen me, and maybe we've danced together in Club Quarantine on Instagram as we've looked for ways to entertain ourselves in new ways. We have faced all kinds of new challenges and new opportunities, kind of going back to Dalia's chance of a lifetime mantra that I think is so important in this new world. And so just recognizing that, we have taken on a lot in a short amount of time. Zoom published some numbers that contrasted their usage in 2019, which equaled to about 10 million video meetings in all of 2019. They published these numbers in May of 2020 and reported that from January to April of 2020, they had hosted 300 million meetings, Zoom meetings, in just those 4 months. And so we have adapted in a rapid way to this new environment. And it's really allowed us to continue on in some amazing ways. But we're also learning about how this online and technology saturated experience affects us. And Stanford University's Virtual Human Interaction Lab has shown that just subtle little inconsistencies in audio and video matching up puts a lot of taxing stress on our brain, on our cognitive functioning. We are wired to be able to pick up subtle signals, communicate effectively with people, kind of see how their eyes are, and any creases in their face that might suggest some sort of emotional context of what is being presented, and some of that gets lost here, or if there's a little bit of a lag. And so this phenomena of Zoom fatigue has begun to be recognized, not as a diagnosable condition that you know is on par with you know generalized anxiety or major depressive disorder, but it's something that has similar effects to many people who overuse video conferencing. And so that can include tiredness, increased anxiety, worry, kind of this irritability of being on edge, because our brain has been, your brain probably today in attending a virtual summit is taxed after spending time trying to concentrate in this different environment. I went over this delay of synchrony. That's what that Stanford University lab describes, the matching up of these facial and audio gestures at the same time, and when that's just a little bit off, that again taxes the brain. We recognize that even though we're face to face, communication was never just about this area of our bodies. We take in so much more information, nonverbal cues. We might take a moment to pause and look out, into a thought, staring at a wall or a window. But here, you don't know what's over there, and it distracts and kind of changes the dynamic of the communication that's happening. They've even measured that just the closeness of the face on whatever size screen you may be looking at may create this sense of impending threat. That this person is kind of looming over me in this way that I'm not used to, that my mind only knows how to interpret it as threat and not just say, oh, this is a face on a screen. And then just the vigilance that it takes to stay focused on a camera, stay focused on somebody or maybe a group of people that might be talking and trying to pick up, who's talking and what are they saying. All these things add to this experience of, oh, this is overwhelming. This is too much. On top of just learning the basics of new technologies. But it's not all doom and gloom, and we can look at it as an opportunity to really expand our knowledge base. And this is really important, that many of us thrive on technological changes, and in particular, older people and older adults. This is really significantly important because of the importance of fostering neuroplasticity or opportunities for the brain to rewire and change and adapt and grow. That has a lot of benefits later in life. Things like increased memory retention, increased cognitive functioning, better mood, have all been linked to really robust signs of neuroplasticity in especially an older adult population. And so we can look at WebEx as an opportunity to learn something new, figure something out, and really, how do I give a presentation on an online platform where I don't have eyes that I can look into and engage in a traditional way and see it as something that I get to do, not that I have to do. And this is an important part, that's get to versus have to, because studies have shown, particularly this one in 2016, that when we are in high stress, low control types of jobs, that leads to early and increased mortality rates. And so it's not just a stressful job or changes or things like that, but this ability to feel like you have some sort of sense of control over the situation. And that is in jeopardy here. We have been put into something that is very unknown, very confusing, and feels out of our control at many times. And so it is a challenge to find those moments of what is something that I can take on in a way that makes me feel like, okay, I've got this. I have figured this out. This is something I get to do, an opportunity, versus something that has been thrusted upon me and that I have to. This will also apply here in this area of the reorg, and this is specific to Dallas College right now, and as our campuses consolidate to this one organizational structure. But this is applicable to all kinds of different areas. So many different workplaces have had to adapt and change due to the pandemic, and we have seen, the importance of work, not just for, keeping the economy going and these other really important aspects of working, but just recognizing that work is important regardless. It does provide our economic stability. It adds to our social life. We interact with people, and this is a key environment that our social life plays out in. And it adds to the sense of personal satisfaction, like I'm doing something with my life that is meaningful and it has purpose, gives me purpose. And so anytime there's a disruption there, even with whatever that outcome is, and we're going to be very optimistic and say the reorganization that we're going through right now is for the better, and it's going to serve faculty, staff, students, administrators in a really good way. But regardless of that outcome, the process of going through it, study after study after study shows that it really has a negative effect on those that are going through it at the time. Short-term, and that's that short-term negative impact, but they can lead to longer-term impacts on health and well-being as well. There is less studies there, and that's where to specify to a lesser extent the longer-term negative impacts is just that there hasn't been as much research there. But the studies are showing that increases in biomarkers that show stress. I think Dalia was talking about this earlier in recognizing that stress hormones really create a physical response in our bodies to stressful events. And when those are chronic over time, it not only leads to stress and anxiety, but those levels can become depleted. Our neurological ability to continue to produce those chemicals at a sustained high level can become depleted, and can even add to things like depression and change our overall health. And again, this shows that this is shown in declines in physical and mental health, leading to increased use of sick leave by employees, poor job performance and satisfaction, overall satisfaction. And again, we're hit with two significant studies that show even mortality is increased risk for mortality is a part of the negative aspect of going through something like major downsizing or reorganization. So it's significant. But again, echoing the mantra of chance of a lifetime, we can make the most of this. There's a British psychologist, Maria Kortowitz, whose recent paper on this really challenged me and framed, this aspect of what would we like work to look like. And so we can look at it in a more traditional way, to say, like, employers and workplaces have a role to help employees manage stress. That we, as we look around to our areas of influence, we can take time to acknowledge and kind of input certain things to help regulate stress, and some relaxation techniques, things like that. And this really uses this definition of resilience as the ability to continue to produce within a challenging context. I need to take care of my workers because we have important work to do, and we've got to keep kind of oil in the cogs and kind of keep it flowing well. And this is the more challenging because it's a real rethinking of what work and potential for work, what work can look like, to really replace this value of kind of productivity that comes from, like, this industrial look of an assembly line and kind of moving things as quickly and as efficiently as possible, with a value for meaning making and seeing the workplace as this prime way that most of us as humans find meaning and purpose in our lives, and encouraging that in ways that redefine what resilience is. Resilience here is knowing when to rest and remove oneself from an adverse setting, not squeezing every last bit out over and over and over again in the most efficient way, but leaving room for some stores to still be left there for the person to encourage slowing down, reflection, and really encouraging autonomy, teamwork, personalized goal setting, job crafting, and even, like, being able to describe what a work role looks like. These are all aspects that can contribute to this. Slow living here is a really important piece, and more research is showing how a 4-day work week, not a condensed, 40 hours within four days, but a real 4-day work week has benefits on productivity, on job satisfaction, on job performance, all these things that you would want, but it's counterintuitive to that. Stepping back, slowing down, could potentially create that positive environment. And the goal here, or the values that are driving this, are different than just, what's that bottom line, what's the productivity. Instead, it's can self-compassion, compassion for others, care for others also meet those goals. And particularly in healthcare fields, it's been shown that healthcare workers that show higher levels of compassion and slow down, contemplate decisions before making them, actually are rated with higher levels of care for their patients. And so we see here that these two things can work together. And again, this is a chance to rethink and adapt in a way that may be better than where we left off. But of course, acknowledging that this is a difficult time, and especially for employees, those of us who are going through this reorganization, you have this wonderful resource that is available through Alliance Work Partners. This is our employee assistance program that is accessible to all full-time employees. There's a number of benefits that are accessed through this, particularly free counseling, free and confidential counseling that's separate from anything through our, it's accessible through our employment, but it's not through your insurance or anything like that. And so free counseling, all kinds of information and things that are aimed at helping you find that work-life balance. And so that information is there for you. And then we'll continue on to what's available for students.
So mental health services via telehealth is not something that's new. It actually began in 1959 at the Nebraska Psychiatry Institute, where they did video conferencing in groups. But it's actually new to us. We started doing the video conferencing or the mental health services via telehealth when we received the stay-at-home order as a way to continue servicing our students and providing services to help them with their mental health. The WebEx end-to-end encryption, that is the video conferencing platform that we use to see our students and to also host events for students and staff. The end-to-end just means that there's a conversation from one device to another that can only be accessed by the sender and the receiver. And then HIPAA, which is the Health and Insurance Portability Act, that was passed in 1996 with the purpose of standardizing the exchange of electronic data and protecting privacy. And FERPA is the Family Educational Rights and Privacy Act that was passed in 1974 as a way to protect the educational and health records of students. Electronic health record is basically the digital version of the old school pen and paper files that your doctor used to have. And the electronic health record that we use is titanium. And then informed consent is a document the client signs stating that they are voluntarily entering into counseling services, and it informs them of any limitations of confidentiality or any other types of limitations. And since we continue to see students virtually and have begun recently seeing them in person, they are now required to sign 2 informed consents, one for the virtual services and one for the in-person services. So as you can tell, as licensed professionals, we take students' confidentiality very seriously, because it not only protects the student, but it also protects us as professionals.
Yeah, and as mentioned, we have just started to see students in person as far as student services goes, so academic advising, some other student services offices are also available for in-person sessions. And counseling is part of that, and so we have adapted to create both that private and confidential environment while also providing a safe experience health-wise. So students seeking in-person sessions must go through a training, if they have not already, about how to keep safe during a pandemic. There is an app that all those who are coming onto campus complete daily as they're coming onto campus that provides an accurate record of their health at that moment. Of course, face masks and social distancing, and that real care to the best of our ability, kind of knowing that there's a few different processes. You know, in the past, the student might be able to come straight to the counseling office and be checked in. Now we have greeters on campus that are checking students in, and so there are a few other aspects, but overall with the goal of protecting our students' privacy and confidentiality.
So on a previous slide, I mentioned some strategies that the American Council on Education had recommended that campus administrators should employ to ensure the mental health and well-being for all. And so these are some resources that Dallas College has put into place to ensure mental health well-being for our students as well as for our faculty and staff. So in our eCampus shell, you can now find a learning community. It's the Counseling and Health and Wellness Learning Community that provides information and resources, information about seminars, sessions, and things of that nature to promote mental health and well-being. On December 3rd, we're going to have a virtual mental health symposium, and so it's going to focus on mental health fitness, survive and thrive. So you guys want to make sure that you register for that. Our counseling centers across our campuses are providing workshops for our students as well as faculty and staff, anybody that's a part of our Dallas College family, where they can take advantage, of this resource so that they can, again, gain tools and things of that nature to promote mental health and well-being. Okay to Say provides resources and strategies for talking about mental health issues, whether they're yours or whether they're someone else. And it also includes specific information for coping with COVID-19. Half of Us is another resource that's available. If you're feeling anxious, stressed, or you just don't feel right, you're feeling weird, there are resources that are available there to help, The Trevor Project, this particular resource, aids specifically to the LGBTQ youth, so that's available as well. And then TAO, it's a therapy assistance online, so it's an online tool with 150 brief interactive sessions that cover topics like mental health, wellness, and substance abuse as well. That's also available. And so Dalia is going to talk to us more about TAO. Next slide, please.
So we're really excited about TAO. Dallas College launched it in August. August. And it's a great tool. It's an online tool that's anonymous when people sign in and create an account. It's got a number of modules in there for well-being, resilience, and behavioral health. Next slide. So there's 9 pathways in TAO. So, and in each pathway, there's like 55 modules per pathway. So there's 122 sessions, and these pathways go from let go and be well, calming your worry, improving your mood, interpersonal relationships, recovery skills, that's about substance abuse, pain management, leaving your blues behind, depression, and very evidence-based tools in TAO. There's cognitive behavioral therapy model, there's the acceptance and commitment therapy model that's used for these modules. It's very, very easy to create an account. You can find the information on how to do so on the Counseling Services webpage. So basically, you're going to go to us.taoconnect.org/register. You're going to use your name and last name, and you're going to use your college email address, create a password, and then you're signed up. And like I said, it's anonymous, confidential. No one can see that you're using TAO. You could even share TAO. For example, you can hook up your computer to your TV using an HDMI cable, and you can stream the information so you can share it with family. Thank you, David. You can, yep. Here you go, Grenalda.
Unmute. So now more than ever, it's very important to incorporate self-care and relaxation into our daily, often hectic schedules. I think specifically this week with the election and the growing coronavirus numbers, it is very important that we just take time to take a breath and just try to relax. And it's kind of funny when you think about it, when we're children, we're in such a hurry to grow up, and then when we become adults, it's like, oh, I want to slow down, I want to relax, and just trying to figure out that balance. You can change. Next slide, please. So what does self-care kind of include? It can include making sure that you have a good sleep routine. They say try to get at least 7 to 9 hours of sleep, which may seem far away for most of us, but at least attempt it. Take care of yourself by taking care of your gut. Exercise daily as a part of your self-care routine. That exercise can look like a walk, yoga, cardio, dancing in your office or your bedroom, anything that just kind of gets your body moving. Making sure that you're eating right. So looking at what you're eating, I know for a lot of us, we've been eating a lot of junk food and just kind of whatever's there and snacking more because a lot of us are working from home. So just kind of looking at what you're eating and making some changes. saying no to others and saying yes to your self-care. Taking a self-care trip, that could be going to whatever city is next to you. That doesn't mean necessarily going out of town, and maybe having dinner, just trying to get out and have some sense of normalcy. Taking a self-care break, getting outside. I think that's very important, especially for those people that are working at home, to take a break and just go sit outside and get some fresh air. Let a pet help you with your self-care. I'm a dog mom, so having my pet has really helped me through this whole crisis. They just bring you so much joy, and walking them and getting out, and it's kind of forcing you to exercise. Take care of yourself by getting organized. Just kind of look at what your space looks like. Is it something that's making you feel calm and peaceful, or is it something that's causing you to have anxiety because you have files and just things everywhere? So taking a look at your space and seeing how you can make improvements. Cooking at home for self-care. I think a lot of us are doing that now because we're not going out as much as we used to and eating out in public. Reading a book on self-care for self-care. So finding out, what does self-care really mean? What does that include? Scheduling your self-care time and guarding that time with everything you have. So once you figure out, okay, I'm going to do this 5 minutes a day or 10 minutes a day, making sure that you stick to that as close as possible, where it becomes a habit and a routine, that you take time out for yourself. Next slide. So this slide is just talking about meditation and mindfulness and the importance of learning how to recognize your breaths and not just really focusing on calming your mind. That's too difficult to do, and that's too hard to start off doing. So just at first, just sitting with yourself and just kind of recognizing your breath by taking deep breaths. It talks about looking at the emotions that you're experiencing when you're just trying to be still. You can do this with your eyes opened or closed, just depending what's most comfortable for you. And then just making sure that you take time to do it. It could be 5 to 10 minutes starting out a day or every other day, whatever works for you. And you'll find that once you start doing it more, you'll really want to incorporate it in your daily lifestyle. Because when we do mindfulness or do meditation or just taking that time out for ourselves, the self-care even, we find that our mental health and our physical health will improve because we're not as stressed, because we hold tension and stress in our bodies. And you'll find that once you actually try to sit down and do breathing exercises or any type of meditation, you'll be like, oh, wow, I'm holding stress in my shoulders or in my neck. And so it's something good, I think, to try. So the last couple of slides are just the references and resources that we used during the presentation. I'm including information about NOVA, which is the crisis response team that a lot of the counselors have had training on, several journals, and, of course, TAL. And that's it. So thank you, everyone, for attending. If there's any questions, remember to put them in the chat.
We did have one question earlier. Someone wanted to know if it would, at the slideshow would be shared with the participants.
I think that's possible. We've shown all of the references here, so we'll be good to go to show, to share the presentation. I really want to take time to just thank everybody who's listening, who's on. Do please take this on as a chance of a lifetime to be a mental health advocate for our students and for the people that you care about. We're all experiencing this crisis together, and we have to help each other and help ourselves. So please be a part of TAO. It's not that difficult to join, and like I said, it's very confidential.
Well, thank you guys so much for facilitating this training today. If anyone else has any questions, please do post them. I'm not seeing any currently. We did have a comment that said thank you for doing this presentation. This topic is so needed in these times. And I have to agree, 2020 hasn't been easy for anybody, and certainly not our students. So I really do appreciate all of you who presented today for being such an active part of providing for our students and our staff and our faculty. Thank you again, everyone who attended today.